Gastric ulcers, also known as peptic ulcers, are open sores that develop on the lining of the stomach. They can cause significant discomfort and, if left untreated, can lead to serious health complications. Fortunately, with proper care and treatment, gastric ulcers can be managed and healed. In this video, we will explore the symptoms of gastric ulcers, their causes, and the various treatment options available to help you manage and recover from this condition. What is a gastric ulcer? A gastric ulcer is a type of peptic ulcer that occurs specifically in the stomach lining. Peptic ulcers can also develop in the upper part of the small intestine, duodenal ulcers. These ulcers form when the protective mucous lining of the stomach is damaged, allowing stomach acid to erode the tissue beneath it, leading to painful sores. The most common causes of gastric ulcers include the overuse of non-steroidal anti-inflammatory drugs, NSAIDs, excessive alcohol consumption, smoking, and infection with the bacterium Helicobacter pylori, H. pylori. If left untreated, ulcers can cause bleeding, perforation, a hole in the stomach lining, or gastric cancer in rare cases. Symptoms of gastric ulcers. Gastric ulcers can vary in severity, and some people may experience mild symptoms or none at all. However, typical symptoms include 1. Abdominal pain. The most common symptom of a gastric ulcer is a burning or gnawing pain in the stomach area. 1. The pain may occur a few hours after eating or when the stomach is empty. 1. In some cases, the pain may come and go, or it might worsen at night. 2. Indigestion. People with gastric ulcers often experience a feeling of fullness, bloating, or nausea. 2. This discomfort can be accompanied by belching or heartburn, especially after eating. 3. Nausea and vomiting. Ulcers can cause nausea, and in more severe cases, vomiting may occur. 3. Vomiting may sometimes contain blood or material that looks like coffee grounds, which is a sign of internal bleeding and requires immediate medical attention. 4. Loss of appetite. Due to the pain or discomfort caused by the ulcer, many people with gastric ulcers may experience a reduced appetite or may feel full after eating only small amounts of food. 5. Dark or tarry stools. Bleeding from an ulcer can cause stools to appear dark or tarry in color. 5. This is a sign of digested blood and should be addressed by a healthcare provider immediately. 6. Weight loss. Unexplained weight loss can occur if the ulcer causes a significant loss of appetite or if there is chronic bleeding. 7. Fatigue. Chronic bleeding from the ulcer can lead to anemia, resulting in feelings of fatigue, weakness, or dizziness. Causes of gastric ulcers. 1. Helicobacter pylori. Infection. The bacterium H. pylori is a major cause of gastric ulcers. 1. It weakens the stomach's protective mucus layer, making it easier for stomach acid to damage the lining and create ulcers. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Frequent use of NSAIDs, such as aspirin, ibuprofen, and naproxen, can irritate the stomach lining and increase the risk of developing ulcers. 2. These drugs inhibit the production of prostaglandins, which help protect the stomach lining. 3. Excessive alcohol consumption. Drinking large amounts of alcohol can irritate and erode the stomach lining, increasing the risk of developing ulcers. 4. Smoking. Smoking not only irritates the stomach lining, but also reduces the production of bicarbonate, a substance that helps protect the stomach from acid. 4. This increases the risk of ulcers and impairs the healing process. 5. Stress. While stress alone is not a direct cause of gastric ulcers, it can worsen symptoms and slow healing. 5. Stress can increase stomach acid production, further irritating the ulcer. Treatment options for gastric ulcers. The treatment of gastric ulcers focuses on relieving symptoms, promoting healing and preventing complications. Treatment options may include medications, lifestyle changes, and sometimes surgical interventions in severe cases. 1. Antibiotics for H. pylori infection. If an H. pylori infection is the cause of the ulcer, antibiotics are prescribed to eradicate the bacteria. 1. A combination of antibiotics, typically taken over a 2-week period, is used to ensure complete eradication of the infection. 2. Proton pump inhibitors, PPIs. PPIs are medications that reduce stomach acid production. 2. By decreasing acid levels, PPIs help relieve pain and promote the healing of the ulcer. 2. Common PPIs include omeprazole, lansoprazole, and pantoprazole. 3. H2 receptor antagonists. These medications also reduce stomach acid production, though they are not as potent as PPIs. 3. They work by blocking the histamine receptors that trigger acid production in the stomach. 3. Examples include ranitidine and famotidine. 4. Antacids. Antacids can help neutralize stomach acid, providing quick relief from symptoms such as heartburn or indigestion. 4. They are typically used on an as-needed basis for temporary relief. 5. Cytoprotective agents. These medications help protect the stomach lining from further damage and support the healing process. 5. Sucralfate is an example of a cytoprotective agent that is often used to treat gastric ulcers. 6. Avoidance of NSAIDs and alcohol. If your ulcer is caused or worsened by the use of NSAIDs or alcohol, avoiding these substances is essential for healing. 6. If pain relief is necessary, your doctor may recommend alternatives to NSAIDs, such as acetaminophen. 7. Surgery in severe cases. In rare cases, when an ulcer causes complications such as perforation, bleeding, or obstruction, surgery may be required. 7. Surgical options include procedures to remove the ulcer or to repair the damaged area of the stomach lining. Lifestyle changes to support ulcer treatment. In addition to medications, certain lifestyle changes can help promote healing and prevent the recurrence of ulcers. 1. Eat small, frequent meals. Eating smaller meals more often can help reduce stomach acid production and minimize irritation to the ulcer. 2. Avoid spicy, acidic, or fried foods. These foods can irritate the stomach lining and worsen ulcer symptoms. 2. Stick to bland, easy-to-digest foods like oatmeal, rice, and cooked vegetables. 3. Quit smoking. Smoking can impede the healing of ulcers and increase the risk of complications. 3. Quitting smoking is an important step in the treatment and prevention of gastric ulcers. 4. Manage stress. While stress is not a direct cause of ulcers, it can exacerbate symptoms. 4. Engage in stress-reducing activities such as yoga, meditation, deep breathing exercises, or walking to improve your overall well-being. 5. Limit caffeine and alcohol. Both caffeine and alcohol can irritate the stomach lining and should be consumed in moderation or avoided altogether during ulcer treatment. Conclusion. Gastric ulcers are a common condition that can cause significant discomfort, but they are treatable. Recognizing the symptoms early and seeking appropriate treatment can help prevent complications and promote healing. If you suspect you have a gastric ulcer, it's important to see a healthcare provider for proper diagnosis and treatment. By following your doctor's recommendations, taking prescribed medications, and making lifestyle changes, you can manage your ulcer and reduce the risk of future occurrences. Take control of your health by maintaining a healthy diet, avoiding irritants, and managing stress, and you can recover fully and lead a comfortable life. Forto Mini.